Hi, my name is Ria Shetty and I am a graduate student at Columbia School of Public Health, and I'm here to talk about why healthcare accessibility is important to me. As someone that wants to go into the medical field, I think that physicians have a responsibility to advocate on behalf of their patients to ensure that they're getting the best care possible, and I think it's an important asset of that. I think that healthcare is a human right, and in order for people to actually be able to utilize the systems that we have in place and the services that we have to provide, accessibility is the #1 component to ensuring that it's being used to its fullest extent. I don't think it's fair that people are put in circumstances where they aren't able to live their fullest life just because healthcare has become inaccessible due to different policies or legalities. So that's why healthcare accessibility is important to me. Thank you.
Beams, y'all. My name is Andrew Defy, aka the Gorilla Poet Laureate, aka the Hoodie God, aka Spittin' Quarantino, aka I wear my sunglasses at night indoors because my eyes are as sensitive as my heart is, y'all. And we are back for another episode of the internet's favorite community health live stream, where we get down to the health of it all with medical professionals, policymakers, and thought leaders while giving you a little news and hunting a little joy. This week, we've got Dr. Alice Chen, who are at Covered California, so we're going to talk about the state's latest insurance options, access, barriers, and the importance of healthcare providers going deeper than just surface physical health to understanding how social needs affect our overall health. We're going to hopefully clear up some of the confusion around vaccines and the Delta variant. Some new studies came out last month documenting racism in the healthcare system in numerous ways, including patients of color being less likely to get specialists than white patients, and also prescribed pain medication at lower doses than their white counterparts. We're going to dive into all of that and more this week. Episode 35 starts now. Okay, I was really hoping that this segment of the show was coming to a slow, grinding halt, and that eventually I'd have to change the name of the show because of relevance. But alas, we're starting to see some rises in numbers with this Delta variant. While we're seeing an uptick in cases, we aren't seeing the percentage of deaths that we were at the height of the pandemic, and that is a good thing, y'all. What's the latest we know on the Delta variant? How is it shifting mandates around the country, and how does any of that affect you? Here's a great segment from the big homies at NBC Nightly News to help clear up some of the confusion.
As Americans face infection and hospitalization at a staggering rate, tonight new findings from the CDC say the war has changed in the battle against COVID. New data made public today likens the Delta variant spread to the chicken pox. As the virus leaves person to person, it's more contagious than the common cold. Likely triggering more severe disease than previously known, the Delta strain is also infecting the vaccinated at higher rates, as they carry similar viral loads in their nose and throat as the unvaccinated. And while they too may easily spread the virus, the inoculated are rarely hospitalized.
The message is not that the vaccines aren't working. The message is not enough people are getting them. The efficacy of a vaccine that isn't given is exactly 0%.
Despite the spike in cases, it's important to remember we are nowhere near last winter's surge in cases or the daily death count. Still, with the new data providing some concrete numbers on breakthrough infections, the concerning findings are why the CDC called for the vaccinated to also wear masks indoors in high-risk communities earlier this week. But scientists recommended the CDC go further, saying universal masking is essential.
The Delta variant has been a game changer. I think no one expected that it would have a contagiousness index as high as this. No one would have expected that this virus could be as contagious, say, as chickenpox virus, or more contagious than smallpox virus.
As Disney and Walmart add vaccination requirements for some employees, the CDC is still struggling to convince some Americans to wear a mask, much less get vaccinated. This as more are falling seriously ill every day.
Love you.
I love you.
Brody Baker can only see his father, Daryl, through glass. On a breathing tube, he nearly lost his life because he didn't want to get vaccinated.
That little boy out there is ready to have a vaccine.
A family nearly torn apart when hope is just a shot away.
Miguel, I have to ask, with cases trending in the wrong direction, has there been any talk of possible lockdowns?
Well, Lester, the White House said there would not be a return to any lockdown, that vaccines can stop the pandemic. And on that front, there's some good news. The average number of people getting new vaccinations is up 30%.
So there has been a lot of confusion from local community leaders all the way up to the president, how vaccines work to support our immune systems and how much protection they provide from contracting a highly contagious virus. With positive cases in the vaccinated population on the rise, does this mean that the vaccines are failing? Let's see if we can clear some more of that up with a little help from our friends at TED. Spoiler alert, the answer is no.
In 1796, the scientist Edward Jenner injected material from a cowpox virus into an 8-year-old boy, with a hunch that this would provide the protection needed to save people from deadly outbreaks of the related smallpox virus. It was a success. The 8-year-old was inoculated against the disease, and this became the first ever vaccine. But why did it work? To understand how vaccines function, we need to know how the immune system defends us against contagious diseases in the first place. When foreign microbes invade us, the immune system triggers a series of responses in an attempt to identify and remove them from our bodies. The signs that this immune response is working are the coughing, sneezing, inflammation, and fever we experience, which work to trap, deter, and rid the body of threatening things like bacteria. These innate immune responses also trigger our second line of defense, called adaptive immunity. Special cells called B cells and T cells are recruited to fight microbes and also record information about them, creating a memory of what the invaders look like and how best to fight them. This know-how becomes handy if the same pathogen invades the body again. But despite this smart response, there's still a risk involved. The body takes time to learn how to respond to pathogens and to build up these defenses. And even then, if a body is too weak or young to fight back when it's invaded, it might face very serious risk if the pathogen is particularly severe. But what if we could prepare the body's immune response, readying it before someone even got ill? This is where vaccines come in. Using the same principles that the body uses to defend itself, scientists use vaccines to trigger the body's adaptive immune system without exposing humans to the full-strength disease. This has resulted in many vaccines, which each work uniquely, separated into many different types. First, we have live attenuated vaccines. These are made of the pathogen itself, but a much weaker and tamer version. Next, we have inactive vaccines, in which the pathogens have been killed. The weakening and inactivation in both types of vaccine ensures that pathogens don't develop into the full-blown disease. But just like a disease, they trigger an immune response, teaching the body to recognize an attack by making a profile of pathogens in preparation. The downside is that live attenuated vaccines can be difficult to make, and because they're live and quite powerful, people with weaker immune systems can't have them, while inactive vaccines don't create long-lasting immunity. Another type, the subunit vaccine, is only made from one part of the pathogen, called an antigen, the ingredient that actually triggers the immune response. By even further isolating specific components of antigens, like proteins or polysaccharides, these vaccines can prompt specific responses. Scientists are now building a whole new range of vaccines called DNA vaccines. For this variety, they isolate the very genes that make the specific antigens the body needs to trigger its immune response to specific pathogens. When injected into the human body, those genes instruct cells in the body to make the antigens. This causes a stronger immune response and prepares the body for any future threats. And because the vaccine only includes specific genetic material, It doesn't contain any other ingredients from the rest of the pathogen that could develop into the disease and harm the patient. If these vaccines become a success, we might be able to build more effective treatments for invasive pathogens in years to come. Just like Edward Jenner's amazing discovery spurred on modern medicine all those decades ago, continuing the development of vaccines might even allow us to treat diseases like HIV, malaria, or Ebola one day.
From Kaiser Health News. The budget package Democrats are assembling in Congress would likely provide the biggest jolt to the American healthcare system since the passage of the Affordable Care Act in 2010, according to sources familiar with work on the plan. Democrats announced Tuesday night that they had reached a framework for a $3.5 trillion budget plan that would cover healthcare, education, climate, and tax changes sought by lawmakers and President Joe Biden. This would definitely be the biggest boost since the ACA, a Senate Democratic aide said. A large portion of that spending would be dedicated to healthcare, targeting major sections of the system, some with new regulations and some with a generous increase in federal funding. The plans are part of what is known as a budget reconciliation, a technical procedural bill that allows Congress to pass spending and taxation legislation with a simple majority without the threat of a filibuster in the Senate. Since Republicans have vowed to oppose the additional spending and the Senate is evenly split, Democrats would need to get all members to agree on the reconciliation plan and Vice President Kamala Harris to cast the deciding vote in the Senate to pass it. According to another Democratic aide familiar with the ongoing work, the portion of the reconciliation affecting health would focus on 5 areas. These 5 areas are creating dental, vision, and hearing benefits in the Medicare program, expanding long-term care benefits to help people getting home and community-based services, extending the ACA expansion under the already passed $1.9 trillion COVID-19 relief bill, the American Rescue Plan, closing the Medicaid coverage gap in the states that refuse to expand coverage under the ACA, and last but not least, reducing the cost of prescription drugs. Our guest tonight is no stranger to the fight to get Americans insured. She is the Chief Medical Officer at Covered California, the state's insurance marketplace, and tonight she is here to help us through the maze that getting yourself insured can be. She played a leadership role in the state's response to the COVID-19 pandemic in the areas of strategic reopening, hospital surge planning, data analytics, and therapeutics, and she's here with us tonight. Dr. Alice Chen, y'all. Dr. Alice Chen, how are you today?
I'm doing well. Thank you for having me.
Oh, I'm so excited to talk to you. You serve as the Chief Medical Officer at Covered California. Can you tell our audience a bit about what Covered California does and what your goals are as Chief Medical Officer?
Absolutely. Well, I hope you've seen the masks. I wish I'd brought one to show you.
I have one just out of reach,
oh,
actually.
Fantastic. Fantastic. So Covered California is the state's health insurance marketplace, or Obamacare exchange. And what I would say is we're part of the state's multi-pronged strategy to get to universal coverage. You know, California was one of those states who really leaned into the Affordable Care Act, expanded Medicaid out of the gate, stood up Covered California. And, I'm saying this not just because I'm at Covered California, but if you ask around, we are widely seen as the exemplar of what an exchange should be. And the reason for that is really threefold. One, we are what's called an active purchaser. So when people sign up for us, we have done a lot of work to make sure that you have enough plans and the right plans to choose from. Secondly, we really work with the plans to standardize the benefit design so you know exactly what you're getting at each level of coverage. When you go to other states, it's a little bit the Wild West. You go there and it's really hard to compare because it's like a fruit medley. We really try to do apples to apples comparison to make it easier for consumers. And then lastly, and this is where I come in, we really have a premise that affordability, affordable coverage is a means to an end. And the end is really around quality, equity, getting the care you need. And so I lead our quality, equity, and delivery system transformation work. I do just want to say a couple more words about Covered California. I know this is a very long response, but the reason is because this is a really exciting time with the passage of the American Rescue Plan. So, Covered California was founded by the Affordable Care Act back in 2010. We started in 2014, but with this new administration, the American Rescue Plan put in new subsidies to make things more affordable than ever. And we have an all-time high enrollment of 1.6 million Californians on the exchange, almost half, 700,000 of whom are eligible for $1 a month premiums. Which honestly sounds like one of those fake commercials, too good to be true. Right. But it's actually true. And these subsidies are right now continuing through next year, and Congress is debating whether or not to continue them after 2023. So want to get the word out to people that if you don't have insurance, you're not eligible for Medi-Cal, please come take a look at Covered California. We are constantly trying to do outreach and get the word out.
Absolutely. And thank you for all that y'all are doing in helping us stay insured as an entire state. Thanks to the Affordable Care Act, we've been able to provide health insurance to millions of Americans all around. But there are still some individuals who remain uninsured. What barriers still exist that are preventing Americans from accessing health insurance and healthcare?
Yeah. Fundamentally, it is about affordability. And as you say, the Affordable Care Act did wonders for the country, but I think nowhere more than in California. We are the state that had the single largest drop in uninsured. We're down to about 7%. We have led the way in terms of expanding coverage for undocumented folks. And so, for example, right now, people up below age 26 and now, just now, like over age 65 are eligible for Medi-Cal. We need to continue to close that gap. There's still a gap between 27 and 64. And we need to continue working on affordability for those who make too much to qualify for Medi-Cal, but either their employer doesn't provide insurance or it's just too expensive. And that is where the exchange comes in. Only for those of your listeners who don't know, if you don't have insurance, the only way to get the federal subsidies is to come through Covered California. So, for example, there are a whole group of people who are buying insurance out of their own pockets on the individual market, but what we call off exchange. It's worth their while to come look at Covered California and see, do they qualify for additional subsidies? Because again, they were pretty robust before the American Rescue Plan, but now particularly if you make less than 250% of the federal poverty level, it is very affordable.
Mm-hmm. So a few years ago, we're going to take you back. We're going to time travel a little bit. You wrote a publication.
2 years ago sounds like a decade in the COVID era,
Doesn't it though? So you wrote a publication titled, "What if the role of healthcare was to maximize health?" And in that, you discussed the importance of addressing social needs to improve community health. Can you talk to us about why it's so important for healthcare providers to address social needs in relation to health?
Yeah. Actually, that it is appropriate that we're talking about COVID. So we've known for a long time that healthcare plays a relatively minor role in overall health and health outcomes. There are definitely miracles of modern medicine, but overall, when you look at population health and you look at the fact, for example, that Americans have lower life expectancy than other countries, we have higher rates of many diseases than other countries. Even though we spend an awful lot on healthcare and have some of the preeminent institutions, it's because healthcare, most people think it accounts for about 10 to 20% of health outcomes. What really matters in aggregate is not just healthcare, but the physical environment, health behaviors, and most importantly, probably social and economic factors. And you saw this really play out in COVID, right? So no one can doubt that access to healthcare is critical when you get sick with COVID. You know, if you need the ICU, if you need oxygen, if you need steroids, or, you know, some of the new medications, healthcare is critical. And what we also know is that health behaviors, particularly before vaccinations, and vaccinations is also part of health behavior, has been even more important, right? Physical distancing, masking, you know, trying to stay outdoors, like those things are actually even more important. But then if you back up a bit even more, what determines whether you're able to physically distance, right? Do you have a job where you can work from home? Or are you an essential worker who has to go into work every day? Do you have your own car, or do you have to use public transportation? Do you have a nice large home where everyone has their own room? Or are you living in a generational crowded household where everyone is an essential worker and coming in and out of the home, right? So we know that these kind of social and economic factors are really what drove the disparities we saw in COVID. And so, you know, I still see patients at Zuckerberg San Francisco General Hospital. And every week I see patients who I'm treating their diabetes, trying to control their hypertension, working up their chest pain. But that is all complicated by the fact that they have food insecurity, or they're marginally housed, or, you know, they can't get to their appointments. And so what I would say is healthcare providers, you know, again, just in the course of everyday practice, but certainly in the context of COVID, if you're not, we can't solve all these issues. These are larger societal issues, but if we're not attuned to them, and if we're not screening our patients and connecting them to the right resources, then we're missing out on the big picture. And honestly, we're not going to improve their health. And then what I'd say is healthcare leaders of either health systems or policymakers, we have even more responsibility to figure out how do we invest in those services that actually improve health. So they may not be the most remunerative, but primary care, mental health, substance use services, we know are critical to improving our community health. Serving as anchor institutions, when you're a large hospital system, investing in the workforce through procurement, and then obviously as a policymaker, really thinking about how do we do those upstream investments in safe environments, healthy housing, you know, adequate food that really are going to move the dial on improving both longevity and quality of life for Californians.
And just real quick, because you touched on it, Covered California will help support mental health needs as well, right?
Oh, absolutely. So mental health, so behavioral health, which is the fancy term for mental health and substance use disorder services, are part of an essential benefits package. So all of the health plans on Covered California are obligated to cover those services. And what's interesting is, you know, behavioral health has been long neglected as a society, you know, in the United States. And there's been a lot of work around mental health parity. We are actually working in alignment with Medi-Cal, in partnership with Medi-Cal and CalPERS, behavioral health in California, figure out where are the gaps and how do we as purchasers, because if you think about it, Medi-Cal covers 1 in 3 Californians at this point. 13 million Californians. We cover about 1.6. CalPERS covers about another 1.6. Together, these 3 groups cover about 42% of all Californians. Together, we're looking into, you know, how do we collectively really advance access and quality of mental health services, which is, you know, you're in the context of COVID, ever more critical.
Absolutely. That's kind of why I asked that. I know a lot of people that I know and a lot of people in my community are looking around really heavy for mental health help right now and support. And a lot of folks aren't insured. So it's really nice to know that Covered California will make your coverage affordable, as well as actually helping you get that mental health support that you need to. So
can I just say one quick thing just to your listeners, which is make sure, like, if you have any questions, be sure to call our call center. We have this incredible call center with people who are really knowledgeable, because as much as we have tried to simplify and standardize things, health insurance does have its, complexities. And so I think having someone guide you through the process to make sure that you're not surprised on the back end is really important. And that's why we've invested so heavily in our call center. So if you are uninsured, absolutely, please go online, look up Covered California, call our call center. They will guide you through the process of getting you to the right coverage.
Beautiful. And thank you for having a call center where people like me can call because we don't understand paperwork.
Yeah.
So just to get back just a little bit to the pandemic Lovato that's going on, in terms of the pandemic, is California out of the woods yet? Or is there still a risk of future lockdowns and mask mandates as this Delta variant kind of runs wild?
I think California, the United States, the world is not out of the woods. I would say I spent most of last year deeply immersed in the state's response to COVID. And if there's one word to describe COVID, it's humbling. It is a very, it's going to keep us on our toes. There will be a lot more twists and turns. The Delta variant is just the latest iteration of it. Unfortunately, I think there will be more twists and turns as we go forward. And what I would say is, in terms of mandates and lockdowns, the good news is we've learned a lot about COVID. We know what works. Mandate or not, we know that masking works. We know that staying outdoors as opposed to indoors works. We know that further away is better. And we know that vaccination is really protective. Right now, those are the things we know that work. If we can lean on those, I don't foresee more lockdowns. I mean, honestly, particularly given what we've been through, I think a lot of our businesses have adapted and have been able to mitigate things so that if everyone plays their part, I don't think we're headed for more lockdowns.
Let's hope.
Yeah, let's hope. Okay. I did say it was humbling. So, don't, that's not in stone. That's not in stone.
Well, and, science develops and changes its mind as new information is presented. So we will not hold any of that against you should things turn a whole other way. That's not what we do.
I heard a great quote the other day, which is, those, scientists, they were telling us to wear a parka in January and a t-shirt in June. Like, what are they doing? It's like, okay, well, circumstances change,
Right.
Yeah.
It's so important that we understand that and that we kind of get how science works. We all remember the scientific method from our science projects in 6th grade, right?
Do we?
Okay.
Yeah.
We need a refresher course. Okay, we're working on it. Dr. Chen, I have one more question for you, and it is the question that I ask everyone who comes on this show, and that is, where are you finding your joy today?
I think that is a really timely question, because I think we're in a place right now, or at least I am in a place where I felt like there was this incipient opening, and with the Delta virus, it's kind of this letdown. So I think that is the exact right question to ask everyone. Where can we find our joy? I will say, going back to the outdoors theme, I think I live in the Bay Area, feel so fortunate. I think it is a state that we can spend so much time outdoors. And for me, like going to the mountains, going to the coast, just reminds me there's a world that's a lot bigger and timeless and lasting than what we're going through right now. And then I think the other thing about outdoors is it's a safe place to hang out with your family and friends. And, that connection that we missed so much last year, I think if we do it carefully, I think that's another part of what we've learned, that we can do that safely. So love spending time with friends, bundled up outdoors over dinner.
Well, see, you say you live in the Bay Area. That's why you get to be bundled up outdoors. The rest of us just got to sweat our faces off out here. It's so real. And the getting outdoors. I recently bought a paddle board. That's been my outdoor joy recently. But it's so true. And just finding things to cultivate that gratitude for and kind of keep our spirits up while everything's a little chaotic on the outside. We thank you so much for taking the time and breaking some of these big concepts down to bite size for us. How do we, just real quick for anyone who's wondering, anyone who saw this, how do I get signed up for Covered California?
Go online, Google Covered California, and either start there by if it's off hours and you want to explore on the website. But there's a phone number for our call center. So I would encourage people to call in and get covered.
Y'all make sure that you go call that number. And thank you again, Dr. Chen. We will have to talk to you as the pandemic kind of does its thing and how we're moving and just to get some updates and some updates on the insurance.
Thank you. Thanks for having me.
Oh, you didn't think that you were going to get out of an episode of Masked Up without the racism crisis, did you? We've saved the best for last. There have been a few new studies that dropped in July that help document racism in the healthcare system and how it is affecting our family of color. In a study published July 19th in the JAMA Internal Medicine Journal, it was determined that while visits to primary care doctors were similar across races, data shows that patients of color are far less likely to visit a specialist. There are a lot of reasons for this. Like Dr. Chen said, it's important for providers to consider all the social determinants affecting a patient's health. Another study was released that shows patients of color are provided with less pain relievers and thusly less pain relief than their white counterparts. Here's a story from CW30 in Memphis, and a special shout out to the writers who pulled no punches in this report.
New medical studies have found what many people of color say they already know. Black and white patients are treated differently in the healthcare system. Both studies involved opioid medications, and while they were focused on different things, the bottom line was the same. Race plays a factor in treatment. Jenny DePrizio read the studies and breaks it all down for us tonight.
You may have heard people talk about how they feel that the color of your skin affects the medical care you receive. Well, two recent studies found race is a factor.
What I've seen is culturally that the different cultures, different races are treated differently in healthcare.
Addiction specialist Shanta Ellison isn't surprised by the recent findings of two studies when it comes to race and medical care.
It's disturbing because as we are in society, we're always treated differently.
According to a new study published in the New England Journal of Medicine, researchers looking at Medicare claims found Black patients are less likely than white patients to get opioids for pain management, even when both patients were treated in the same healthcare system. Researchers found that white patients received more pills and stronger doses than Black patients, and researchers say those findings confirm disparities when it comes to pain management. A different study, this one done by researchers at Vanderbilt University, found racial disparities when it came to pregnant women who are dependent on opioids. The study looked at 10 care patients over a 7-year period. It found 72% of pregnant mothers with opioid use disorder or dependency were not given a medication that could have reduced the risk of overdose deaths and improved the outcome of their pregnancies.
So we found that Black mothers, Hispanic mothers, those in rural areas, and those with primary language other than English were less likely to have received these medications.
Researcher Laura Hankhouse says the study found Black mothers were 20% less likely to get the medication than white women.
Race alone predicted much lower likelihood of receipt of this medicated treatment for opioid use disorder.
When I had my son, the nurses, they actually treated me differently.
New mom Anna Rogers isn't surprised by this latest research. During a meeting Tuesday morning at Audubon Park, these women said more needs to be done to eliminate bias in the healthcare system so everyone gets the medical care they deserve.
We just have to fight for equal rights and treatment.
In East Memphis, I'm Jenny DePrizio.
That's another episode down of Masked Up, the internet's favorite community live stream. We really appreciate y'all tuning in every week, especially those of you who don't actually enjoy the show. Your sacrifice for our ratings is most appreciated. As always, thank you to our guest and the rest of the team at Masked Up that make this happen for the 35th time. Help doesn't come from a pharmacy, y'all. Till next time.